Right, you're watching News This. Now, senior citizens in the Upper West region have sharply criticized the Savannah accelerated development of tree planting and guinea fowl projects, asserting that they should be given food to eat instead. They also criticized government's decision to remove fertilizer subsidies, lamenting it will only affect food production in the region. Speaking at the Republic Day commemoration, they urged SADA to help provide subsidies rather than engage in what they called projects that will not satisfy their hunger immediately.
Senior citizens selected from the 11 districts of the Upper West region converged at the forecourts of the WA Presidential Lodge to celebrate the day, share their experience and provide answers to the country's development challenges. They spoke on a wide range of issues including education, agriculture and the Savannah Accelerated Development Authority.
The children suffer a lot. Right now, I think there are textbooks in the basic school, but most schools don't have the textbooks. I think it is good for the Ministry of Education and for that matter, the Ghana Training Service, to let the basic school children have textbooks for a longer period of time and learn, and that will imprint into their brains what they have learned. This is what I have.
A lot of us here even may not be able to name, but as for the deprived, the poorest of the poor, get into these rural areas. Right now, some of them can hardly get a meal a day. And these are the people who feed this nation. So, in fact, just as he said, I would rather suggest that SADA, which has been here for so many years, should come in to subsidize this fertilizer for the farmers. Honestly, I think that SADA has not been grateful to this region.
Outgoing Upper West Regional Minister Bert Zidane commended the senior citizens for the role they played in building the country and challenged claims the country has made little progress since it became a republic.
It is an indictment on all those people who have been working for the development of this country since independence. But they have done nothing. They have done nothing. They have achieved nothing. So, if we go by that logic, why do you celebrate you? It doesn't make sense to turn around and say that we are celebrating you for what you have contributed towards the national development. So I think that we have achieved a lot.
The Upper West Director of Action Aid Ghana, George Derry, whose outfit partnered the Upper West Regional Coordinating Council to organize the event, called on government to take the issues of pensioners seriously.
All people on pension have served this same government. So for some to be government pensioners and others to be pensioners, I don't quite understand, because nobody served Senate. We all serve Ghana government. So I want us to share that name. We are all government pensioners.
The senior citizens were later treated to good music produced in the region, moving a good number of them to swing themselves to the admiration of all gathered. Rafiq Salam's report from WA for Joy News.
So let's go back to a story on how missions hospitals may start rejecting National Health Insurance Scheme card holders effective today, 2nd July 2014. Let's get a reaction from the National Health Insurance Authority. With me over the telephone is Selo Madono. Selo Madono is Communications Manager for the NHIA. Hello, Selo. Well, I think we have lost Selom. So here's what we'll do. We'll re-establish contact with him and then we'll bring back that conversation. Meanwhile, there's been a sharp increase in the prices of foodstuffs, even for those items that are in season. Vegetables like cabbage, for instance, though in season, is selling at least at 400 Ghana cedis a bag, up from 120 cedis a month ago. Now let's watch the detail of that story.
News checks on the prices of foodstuffs in some markets in Accra revealed a hike in their prices, albeit in season. Vegetables are in season due to the rains, but their prices had increased. A bag of green pepper is now selling between 60 cedis to 70 cedis, while a single carrot now goes for 1 cedi.
It's a patrol, you to patrol, saying Tinema Bedu Hana. I never quite have a company cabbage 1 bag per 4 million, 3.8. And to be banament man told wait to say beer 40,000 on top. And Sonisika, it's a man and neighbor, then saying to me, you're also a young faso.
The prices of tomatoes, garden eggs and onions have however remained stable, with 4 of each selling at 1 cedi. Prices of tuber crops have also shot up, with the tuber of yam now selling between 5 and 10 cedis. A sack of cocoyam which sold at 120 cedis is now 150 cedis, while that of plantain is up to 100 from 80 cedis.
Obi ba akosua ene kai beba no obi enra ase esomba Monday esu enam ka omu nyanti na no pen aso mo de nyama no beduye omo ba ye nso no enam say me fa say mankene no omo de my 1.2 a na ka mba na odwum ni so age 100 esu don buy 1.5 mba ni so age 100,000 ntina kwa 1.6 na say 300,000 kwa na ba be ka ho
ayane sana which one is saying
first no when I'm meeting a noon 4 cedi. And so first now I'm meeting 7 4 cedi. And so now I'm never na ya de mama sister and then the mama 800 no. Into some sister na meeting. Yeah.
Commodities such as rice and oil have also seen price increases, with a small bag of rice now selling at 19 cedis from 16 cedis. A gallon of oil also sells at 24 cedis, up from 22 cedis, while a crate of eggs has also shot up from 9 cedis to 13 cedis.
Tomatoes, tomato too. You see, I first now 1 cedi, but I say about 13. And I do know the other.
Let's talk about mission hospitals and the National Health Insurance cards. Selom Adonu is Communications Manager for the National Health Insurance Authority. He's joined me via telephone for a quick reaction. Hello, Selom.
Hi, Kamini.
What's the National Health Insurance Authority's response to this report that mission hospitals will start rejecting NHIS cards starting today?
Well, the response really is that we are in engagement of aspects of our stakeholders in terms of operation. We have had meetings with the Ministry of Finance. I mean, it's all about release of funds and it's all about money. So we've had very extensive discussions with Finance Ministry on Monday. We've been yesterday a holiday. We had meetings and discussions today. A number of meetings will be ongoing and still ongoing. And we've been engaging with the Christian Health Association of Ghana as well. We emphasize with the situation. We are just saying that in the next few days, we will be able to, or we hope to be able to get some releases and settle a lot of the areas that they talk about. So really, this is a position. We're just working around the clock to ensure that there are some releases so we can settle some of the bills that they're talking about.
Can you then say that card holders could actually go to confidently walk to a missions hospital and get access to healthcare?
But you can come again, Kamini. I'm
asking, can you say that today card holders can go to any missions hospital and get access to healthcare?
Well, I'm not supposed to check. I mean, it's been a busy morning, but I'm sure our officers are on the ground to check all these. But I've not had any reports as yet.
But has the Association of Missions Hospital given the NHI any assurance that indeed we will rescind the decision that the decision about rejecting NHIS card holders?
Well, as I stated, we've had a number of engagements, and we are getting to a point. We've had a number of engagements with them, and we are still engaging with them to see how best we can have a win-win situation. And you must also bear in mind that it is not in their interest necessarily to refuse our members or subscribers care. We are in this together. They are one of our most trusted service providers, and we understand their situation the same way they also understand our situation. But we're just trying to arrive at a win-win situation so everybody in the relationship benefit, and it's not a lose-lose affair.
But Salam, how did we get to this point? Accrued debt of 50 million Ghana cedis?
Well, it's not as easy as you say. The NHIA pays 2 million cedis a day for healthcare services. We pay 2 million cedis a day. So you see, 40 million appears a huge figure, but the quantum of monies we pay on daily basis, makes it relatively a bit small. So it's a huge enterprise that the people of Ghana have decided to undertake in terms of financing healthcare. And I think as people of Ghana, we must be ready to also do what it takes to ensure that the scheme grows the way it has to go. So, yes, I can't even confirm the 40 million figure you've mentioned because
50 actually
for me right now. How many? How much?
50.
Okay, I can't even confirm that independently as I speak. But, that is just the scenario I'm telling you. We pay 2 million cedis a day, 60 million cedis a month, for service that is rendered to Ghanaians who are NHI subscribers. So it's a huge enterprise. So
Salam, even after, I know you have to go, so I'm trying to push my questions quickly. Even after we pay the 2.5% levy, we still have the NHI saddled with financial challenges, so much so that you can owe one of your trusted partners, which gives us about 42% of the population healthcare services up to that amount?
Well, I'm not sure about the 42%. I'm not sure about the figure, But what the situation really is that, if you've heard in the past, there's been advocacy, there's been talks, there's been a lot of, engagement to even increase some of the inflows we get. Bear in mind, when the NHI started, we had just about 1 million people on it. Today that I speak to you, we have about 10.4 million people on the same scheme. Utilization is shot up so much so that utilization stands around 27.4 million. That is the number of people or the number of times people go to the hospital, count of the NHIS card a year. So see, it's as if we become actually a victim of our own success. We have high numbers now. We have more people visiting the hospital. The least thing, somebody goes to the hospital, which is good. We have helped to improve the overall health outcomes of people with a card or Ghanaians generally. But anytime you go to the hospital, you are taken care of free of charge. Yes, somebody has to pay for it, which is fine, and that which is really how the arrangement is.
But so we cannot tell. But we cannot tell if the mission hospitals would accept the cards today.
So yeah, I can't say so as I speak. But as I indicated earlier, we have officers, MNE officers, and all on the ground to ascertain the situation for themselves or for ourselves. We are also engaging the service providers to ensure that the situation doesn't exacerbate. We will pay, and we are engaging people, and as possible, we will mobilize some funds to be able to defray the bills.
Salam, I'm grateful for your time.
I'm grateful as well.
Salam Adonu is Communications Manager for the National Health Insurance Authority. Now, you heard him. You're engaging stakeholders, including the mission hospitals, on this matter. We'll bring you more as the story unfolds in subsequent broadcasts. I'm totally grateful for your time here on News Desk. I'll see you again at midday. Now, here's one reason you should tune into News Today at midday today. Because the GFA is holding a press conference on the Black Stars, and we'll be there live. My name is Kimini Yamani Yamana. I'll see you again at midday. Goodbye.